Hi, this is our second video in a series of self-treatment episodes, and this one is on plantar fasciitis. If you haven't ever heard of plantar fasciitis, it's an inflammation or pain at the bottom of your foot, commonly from running or overuse or whatever, and it's overtreated many times or mistreated. I'm going to show you my protocol that I feel works in 80 to 90% of circumstances, and much of it you can do on your own if you want to do the most of the work. So if this doesn't work, then you can always come and visit me, but you can try this at home if you would like. Again, it's an inflammation of the connective tissue on the bottom of the foot. A lot of this inflammation is a result of our modern world that we live in. We use our foot on flat surface floors and we use shoes. You would think, well, why does that cause problems? Well, our foot is designed ancestrally to navigate contour. Contour, our ancestors went barefoot, and the foot is meant to pivot and rotate. And because we do not get this motion through our daily living, when we go and overutilize something that is atrophied, such as our foot, meaning the muscles are not as strong as they should be because we're in a shoe and we're sitting all day long, it breaks down. So the first thing we need to do is treat the mobility of the foot, especially the ability of the foot to go into supination. This is called supination, where the forefoot rotates, where the arch is accentuated. So I'm going to use my foot as an example. What we're going to do here is you're going to take your foot, and I do this in my office with my patients, is that you take and you pull your foot upward and you push down on the plantar fascia and you find any tender spots. And if there's a tender spot, you hold pressure there and treat that tender spot for a little while so we can stretch this plantar fascia. Spend about 3 or 4 minutes working on this plantar fascia, and then work up along the medial aspect above the ankle. And this is called your medial gastrocnemius or your soleus, and go up and down with your foot. This helps to stretch out the muscles that pull the Achilles tendon. This creates the distortion in the foot, so you want to stretch the Achilles. You want to stretch the Achilles tendon and the muscles up and through here, and stretch the arch and stretch the dorsal muscles like this. That's the first aspect of self-mobilization. Then you need to go and find this very specific type of tape called elasticon tape. You can go online. It's elastikon. It's made by Johnson & Johnson. Some people are allergic to this, so watch out. But you need to get this specific type of tape. And what you need to do is you need to tape up the arch with this. So start right around the ball of your foot. Go around a couple of times. Support the arch. Go over the ankle in a figure 8. Come back and around. And go up the arch and finish up the arch. I really had a little bit less tape than I should have here. I don't want to finish on the bottom of the arch, and maybe you want to start up a little higher than I did. I did this because I didn't have as much tape on this roll. So you want to support the arch. This allows for a good function of the foot, but it also reduces the strain to it. And if you leave the tape on for a good week and retape it every week for 3 or 4 weeks and self-mobilize your foot, this will bring you a long ways towards healing the inflammation. Now, the third aspect are exercises, which I'm going to show in a separate video. So you can click on the next video in this linkage for exercises to the foot. So again, mobilize the foot and tape the foot. And if you want to use ice as an application, that's okay. Absolutely skip the orthotics. Do not get talked into spending $1,000 on orthotics at some doctor's office, or even going and buying cheap ones, because all it is a crutch. It is not correcting the strength of the foot or the mobility of the foot. It's like putting a back brace on. What does it do? It gives you relief temporarily, but in the long run it makes the condition worse. So again, skip the boots, skip the orthotics, self-mobilize and tape. Follow up with the exercises after a few days of doing this that I'm going to show in a second video. Thanks for watching.